Hello everyone, I am Mrudula and today's topic is the modifiers in the medical coding. So let's start with the introduction of modifiers. Modifiers are two character suffixes that may be alpha or numeric that are attached to a procedure code. CPT modifiers are defined by the American Medical Association and SCPCS level 2nd modifiers are defined by the Center for Medicare and Medicaid Services, that is CMS. A modifier provides the means to report or indicate that service or procedure that has been performed has been altered by one specific circumstance but not change in its definition or code. Modifiers also enable healthcare professionals to efficiently respond to payment policy requirements established by the other entities. Then modifiers are intended to communicate specific information about a certain service or procedure that is not already contained in the code definition itself. Some examples are to differentiate between the surgeon, assistant surgeon and facility fee claims for the same surgery. Then to indicate that a procedure was performed bilaterally. Then to report multiple procedures performed at the same session by the same provider. To report only the professional component of only the technical component of a procedure or service. To designate the specific part of the body that on which the procedure is performed. For example, T3 left foot 4 digit. Then to indicate special ambulance circumstances. Then modifiers 22, these are for the increased procedure. Specific circumstances that may support modifier 22 includes excessive blood loss relative to the procedure, then presence of excessively large surgical specimen, trauma extensive through enough to complicate the particular procedure and not build and additional procedure codes. Then other pathologies, tumors and malformations that interfere directly with the procedure but are not built separately. Other factors that might support modifier 22 includes morbid obesity, then low birth weight, converting a laparoscopic procedure into the open procedure. For example, the patient lost 1000 cc's of blood rather than the more usual 100 to 200 cubic centimeters of blood for a procedure of this type. Then modifier 23 are for the unusual anesthesia. Under unusual circumstances, general anesthesia may be given for procedures that typically required local or regional or no anesthesia. The modifier 23 should be submitted with the appropriate code to report unusual anesthesia. This modifier should not be reported with the procedure codes which includes the term without anesthesia in the description or that are normally performed under general anesthesia. The payer will review unusual anesthesia claim submission on an individual consideration basis and will provide payments for medically necessary services. Then documentation to support the reported services must be provided with the claim. Then modifier 24, the unrelated E or M service by by same physician or other qualified healthcare professional during a post-operative period. Then during a post-operative period, evaluation and management service performed for a reason unrelated to the original procedure. Each CPT code has a global period that varies from 0-90 days. Some carrier have longer period of time, 120 days. Then the modifier 25 is important because it allows physicians to obtain reimbursement for services rendered that would otherwise be denied if the modifier was not attached. It alerts payers that another significant separately identifiable evaluation and management service was performed by the same physician on the same day. For example, zero global period with the evaluation and management service provided the day of included bronchoscopy then and impacted ceremen in one or both years. Then modifiers 26, which are for the professional component. Certain procedures and services have both a professional and technical component. Use modifier 26 when only the professional component is being built. Use modifier TC when only the technical component is being built.